Hello, my name is Andy Payne, and welcome to my infomercial for BMI 5740. To start off this presentation, first I will be defining what translational informatics is. Simply put, translational informatics is the area of research that deals with data and how it pertains during the transitional parts of fields of research. The first type of translational informatics is also known as T1, and this is from the bench sciences to the clinical studies. The second type, T2, is from clinical studies to practices in the community. For the next part of this presentation, I'll be going over some barriers to translational informatics, and for a few of them, I'll be going to more depth. So one barrier to translational informatics is the lack of willing participants in studies, and this can be seen in the T1 type of translational informatics, where maybe the bench sciences you find this really novel and useful biomarker, but to actually find the population you need for this study that has this biomarker is really difficult. Another barrier to translational informatics could be regulatory burdens. You can imagine that for bench studies like genomic studies, those regulatory laws are probably not as restrictive as those studies in the clinical side that actually deal with humans. So now I will actually be presenting some of the solutions to these barriers. My first solutions are going to be biobanks. So biobanks are just like banks, except for instead of storing money, you're storing some biosamples. So it could be blood, DNA, some other kind of information that you get from other assays. So biobanks can be used as a bridge between bench studies and clinical studies by basically streamlining the data from these bench sciences directly into clinical studies. You can imagine that we can collect biosamples and use them as a form of cohort studies where we study people with these biosamples over a period of time. So specifically, one barrier that biobanks can resolve are the lack of willing participants. By saving biosamples, we can preserve them and expand their use for multiple assays, multiple tests, and basically make each participant more valuable. My next solution is precision dosing. Here, we are actually putting into use what we have learned from clinical studies by finding out the right dosage of any drug for any person. I also want to point out that for this idea, we can also expand it to other treatment methods. The one that comes into my mind is chemotherapy. So I see precision dosing as a type 2 translational informatics because basically we are trying to say how can we put the knowledge we have from clinical research into actual practical use. Also, the other side of this is after we have put this into use, how can we drive clinical research from the knowledge we have gained from precision dosing? Maybe after putting this into use, we find out some other factors that should be studied in order to enhance precision dosing. So here I just want to see if we can expand beyond the common clinical decision support of drug-to-drug interaction per patient. So for the last part of my presentation, I'm just going to be going over one of the barriers that precision dosing addresses, which is basically just creating the infrastructure necessary to translate our clinical knowledge into actual practical use. And in doing so, we actually create a method for which we can engage practitioners of both medicine and researchers so that in the end they can work together and create some form of what we call evidence-based medicine.